I feel like my mum needs more professional help with her mental illness.
I apparently need to be looked after, even though I'm the one that does the looking after.
My sister recently went into hospital. It was brilliant, actually.
When we go and we book in my brothers, they talk about the whole family, what's nice. It's not just my brothers.
They talk down to me and treat me as if I'm a child, but I know I'm a child, but like, I probably knew more than what they knew.
You just need to be understood by the people that can make the difference.
There's general lack of knowledge and understanding of what young carers actually are, and misconception, and not understanding the importance of support.
A young carer is a young person who cares for someone who's unwell or disabled in their family. That can be for a range of different reasons, and it could be a parent, brother, sister, grandparent, someone that generally that they live with or have a lot of contact with.
I've been going to Winchester Young Carers for 7 years now. I like hanging out with my friends here and just being able to talk to someone that understands my situation and stuff. It's just helpful to have that once in a while.
I kind of like the environment that we have at Young Carers. Like, everyone respects each other, everyone knows what's happening at home, and it's just a safe way to express yourself in a way which is nice for everyone, because you know that you're not going through it alone and stuff, and you know everyone's going through it as well.
I think the best things that have happened to me so far is having new friends and being able to socialise with other people who understand what it's like to be a young carer. I like attending because it gives me a chance to get away from the hectic surroundings I have back at home.
Healthwatch Hampshire has been working with Winchester and District Young Carers Group to create this film which explores their experiences of health and social care services in Hampshire. In a series of workshops, the group considered how services could best be improved and how Healthwatch could support that process.
Healthwatch is a brand new organisation. It's a consumer champion, which means that we listen to local people's views about health and social care services and then try to make a difference. So it's an independent organisation made up really to champion what local people think about the services they receive.
We know that our families and young people come into contact with different health and social care services, and often we are on the end of the phone or at the parent coffee morning listening to things that are good and things that are bad. So Healthwatch is the enabling service, I guess, to potentially take that a bit further and make changes.
I think it's so important that we get involved with as many local groups as possible, because these local groups, like Young Carers, really understand what's going on for them and how the services really are for them. And so by listening to what they think, we can really make the biggest impact with the people that make the decisions. And so really getting involved at the community level is so important.
In an initial workshop, the group considered the health and social care services that were most important to them. They wrote down the services and placed them on a target with the most important services in the centre. The group then shared some of their experiences, and Aaron began with his feedback on GPs and pharmacies.
When I was around 10 or 11, my mum told me that I needed to go to the pharmacy to go get her medication because there was no other way to get medication. I tried to go to the pharmacy and said about who my mum was and everything, and they just wouldn't give me the medication. It was quite serious to us, or to me, because I knew that my mum was ill and I knew that she needed to get that medication. And I didn't know what to do. I didn't have many support networks at that time. Young Carers were the only people that were there. My mum and we went straight to our GP when she got better. It took a lot of persuading, but he contacted the pharmacy, said, he was our GP, said I was a young carer. And now that the pharmacy have got to know me as who I am and who my mum is, they have now been able to give me the medication when I've needed to go.
Well, for one thing, they're not really that important to me. They're important to my mum. And let's just say they're not really that helpful. My mum, she's really ill. Yeah, she's just getting so much worse, and they don't explain to me like the actual problems and the medication she's been given and what it does. I mean, I have to ask my mum or my dad, and to be honest, I don't really want to ask my mum because she's ill and she's the one who's having to take it, so.
I've put Naomi House because when we go and we book with my brothers, they talk about the whole family, what's nice. It's not just my brothers. They get looked after nicely.
My sister recently went into hospital with DKA, which is diabetic ketone acetitis. She has type 1 diabetes. She ends up getting admitted to hospital because her levels are sky high. And the hospital were great. We phoned them up and they told her to come in. They done an ECG on her, monitored her, tried to get her levels levelled out, gave her fluids. It was brilliant, actually.
My mum goes into hospital a lot, and there's not always enough space for me and my older sister to go into the ambulance. So I get my neighbour to drop me off, and I just get left, so I have to go looking for my mum. So it would be good if the ambulance service could prioritise who needs to go in with my mum rather than just putting the oldest child in there, because I'm the main carer for my mum. So they can put me with the neighbour because I apparently need to be looked after, even though I'm the one that does the looking after. And I'm generally more aware of all the medication and all that kind of thing, so yeah, it'd be easier if I was there.
I wrote down hospitals and A&E because, well, it's relevant to my family because my brother's in hospital a lot and so is my mum. They're good because they put up a place for me and my mother to stay if my brother's in hospital. But they're very patronising. I know I'm a child, but like, I probably knew more than what they knew. They should just stop assuming that you don't understand everything and start thinking, oh well, maybe they do understand since they've been dealing with this for like the past however many years.
In a second workshop, the group considered specific ways in which services could be improved to benefit the needs of young carers. The ideas ranged from improved communication and staff training through to more complex ideas such as ID cards and information packs.
The one thing I'd like to change about all health services is the communication between parties. I think that is key to families and the services, as it brings them together.
I think the main issue is broken communication between us young carers and doctors. So I've been asked to leave appointment rooms because I'm a child in their eyes.
They could improve by understanding that there's like people who have to look after that certain person and that they need all the information.
There's general lack of knowledge and understanding of what young carers actually are, and misconception, and not understanding the importance of support. Breaking the barrier and the stigma of young carers with a booklet or some information guide that we could give to people actually from us, so it's not just a group of people that sit in offices writing what a young carer is, it's people what we actually are.
If an information pack is personalised, then it means that young carers are not having to repeat themselves to different professionals. It means that they have something to give them the confidence to get their message across.
It would all be there, so like GPs and pharmacists could look at that and could like kind of understand how to talk to the carer.
Every young carer situation is very different. They all face the same issues and have them in common, but depending on who they care for and why they're caring for that person will be very dependent on the support that they need. Our schools work has rolled that out into, I think, nearly all of the Winchester secondary schools. That's okayed by the school. I think if there was an ID card within health services, it would need quite a lot of clout behind it and everyone would need to be on board with it. I know it was discussed around being able to pick up prescriptions, for example. So as long as things have been agreed, I think it would definitely work, yeah.
The ID cards would be approved by GPs and pharmacists, as like you can use that and they will understand that you're a young carer.
Our young people were given the opportunity to sign up as Healthwatch champions, and quite a few of them jumped at the chance. They were very keen to be able to be an ambassador for something that could make change for them as young carers.
Because I am now a Healthwatch champion, I now have the voice to tell people how to change their services to make families happier and have a better experience when they go to use these services.
Our young carers, I think, are quite aspirational, so they really saw it as an opportunity to develop themselves and to develop some skills for them and for the future, which is really important for young carers. One of the key messages would be to recognise young carers and listen to them so that they actually feel heard.
That is the main thing, being understood by people. You don't want to be misunderstood. Because you are a child at heart. You just need to be understood by the people that can make the difference.
This film and Healthwatch Week overall have been a really great opportunity to listen to what local people think about services, and there'll be loads more activities to come in the future. And as Healthwatch goes forward and we listen to as many people as we possibly can, and more people know about Healthwatch, we really can make a difference. So we're really excited for what the future holds and the difference that we can make. There are loads of ways that people can get involved in Healthwatch, and we really want to hear as many views as possible from as many different types of people as possible. So people can contact us through the normal ways, email, website, social media, but also we go out and about regularly to try and set up stands and talk to people as often as possible in their own communities. So watch out for the Healthwatch kind of banner coming to your neighbourhood, I think.